Hi, welcome to Stay Healthy Expert Tips. I'm Dila, your Watson's pharmacist. In today's episode, I'm with Dr.Aslannif Roslan, a cardiologist from IJN, and he will share with us about the importance of the mental on heart health. Good day, Dr. Aslannif. Thank you for spending your time with us. My first question is, what is the correlation between stress and also heart health?
Stress in general is a period of heightened sympathetic drive. This increases the production of harmful pro-inflammatory substances, and this can actually accelerate atherosclerosis, which is the building of plaque in your coronary arteries. Stress is also associated with a poor eating habit, so when stressful, people can start to binge eat. Furthermore, those who take alcohol can increase their alcohol intake, and this can be harmful to the person.
So doctor, any suggestion to take care of a good heart health during this pandemic?
So what you can do is you try to find some things that's relevant to your line of work. For example, maybe if you want to learn new languages, or you want to learn certain musical instruments, and exercise is one of the best way for you to distract yourself, and obviously during MCO, and there's a lot of things that we can't control, and for those that we can't control, we have to learn to live with it. So take one day at a time, but this will be over as long as all of the people be vaccinated.
Doctor, what are the tips that you recommend to prevent a cardiovascular disease?
One of the most important things for you to do is to control your weight, by which we are thin everywhere but we are fat at our tummy. So that is the worst kind of obesity, because that fat also accumulates in your coronary arteries and tend to accumulate in your liver. And one of the most important things to reduce weight is actually to reduce your carbohydrate, and one of the biggest culprit is rice. In fact, in this COVID-19, if you notice, those that died young because of COVID-19, most of them are overweight. And check your health regularly, okay? And few things that you need to check regularly: your blood pressure, your sugar level, and your cholesterol level. And the most important thing is, if you have a doctor that you trust, discuss and have a rapport with the doctor that you trust.
Doctor, here is an extra question for you. What are the symptoms when any of us have it, need immediate medical attention?
Okay, as a cardiologist, for me the most important symptoms is chest pain. Number one is chest pain that you have never felt before. This is chest pain that new in nature. It's like, I have never felt this kind of pain before. Number two, the chest pain that feels heavy. It's as if someone is sitting on top of you, okay? And number three and number four is one of the most important thing. If you have a very bad chest pain that is associated with profuse sweating and also vomiting, is something that you really need to go to hospital as soon as possible. The best thing is to go to doctors and ask for Electrocardiogram or ECG to diagnose heart attack.
Doctor, at what age do you recommend to do a heart health check?
Heart attack happen in any age group. For me, the youngest that I've seen is 19 years old. When you are 40 years old and more, then that is the time for you to start thinking very seriously about the risk of having heart attack.
Thanks, doctor, for your professional advice. It is really helpful for us to taking care of our heart. As campaign quotes, don't break your heart or your heart may break you. In conjunction with Heart Hub Months, all Watson's Pharmacy stores are providing free consultation and blood pressure. Visit your nearest Watson Pharmacy store and speak to our pharmacist. That is from us. Stay healthy and stay safe. Bye!